Hello everyone, myself Bismi P Cheriyan, Assistant Professor at Suresh Vihar University. Today I'm going to discuss about the bile acid sequestrants and the hyperlipidemic agents. So we have seen or we have discussed the anti-hyperlipidemic agents in our previous class. So next classification is bile acid sequestrants and the hyperlipidemic agents. Learning objective of this topic is this lesson will help the students to understand the mechanism of action, uses of bile acid sequestrants, anti-hyperlipidemic agents. Learning outcomes. After this lesson, students will be able to describe the SAR, mechanism of action, and uses of bile acid sequestrants and the hyperlipidemic agents. So first we have to know what is atherosclerosis, what is the condition of hyperlipidemic condition, and what are the anti-hyperlipidemic agents. So atherosclerosis is the buildup of fats, cholesterol, and other substances in and on the artery walls. So atherosclerosis is the buildup of fats, cholesterol, and other substances in and on the artery walls. Okay, so the build-up is called as plaque. Some fats and the cholesterols are deposited on the artery walls, and that deposit is known as plaque. The plaque can cause your arteries to narrow, blocking the blood flow. So that plaque is the form of the fat, cholesterol, and the substances. Okay, so that forms that create a blockage in the artery walls, okay, or arteries. So that blocks the blood flow. The plaque can also burst, leading to the blood clot. So this plaque can also burst, and that leads to the blood clot. So atherosclerosis is the condition in which the plaque is formed inside the arteries, and the plaque is known as the buildup of fat, cholesterol, and other substances in and on the artery walls. When the plaque forms inside the artery wall, there are chances to that plaque burst, and that when the plaque burst, what happens there, that leads to the blood clot. Okay, so when blood clot form inside the artery, what happens, that blocks the blood flow. Okay, so this is the atherosclerosis. Okay, atherosclerosis is the buildup of fats, cholesterol, and other substances in and on the artery walls. And this buildup is known as plaque. The plaque can also cause the arteries to narrow and block the blood flow. The plaque can also burst, leading to a blood clot. So this is the atherosclerosis. Okay, so now you have to know that what is hyperlipidemia. So hyperlipidemia means the blood has too many lipids or fats. Okay, hyperlipidemia means the blood has too many lipids or fats. What are the example of the lipid and the fats? Cholesterol, triglyceride. Okay, so these are the example of the lipids or the fat. So hyperlipidemia is the condition when the blood has too many lipid or fats such as cholesterol and the triglyceride. So cholesterol is again divided into HDL, VLDL, and the LDL, in which HDL is a good cholesterol. Okay, HDL, or we can say um, HDL, high density lipoprotein. Okay, the full form of HDL is high density lipoprotein. So the HDL is the good cholesterol. Okay, so we have to increase our HDL for our good health. Okay, but the VLDL and the LDL, these both are very bad cholesterol, and we have to reduce these two cholesterol. As well as this triglyceride is also bad for our health. Okay, so triglyceride is also a lipid, and that damage our arteries by forming a plaque. So the hyperlipidemia is a condition where the blood has too many fats or the lipids. Okay, and examples of lipid and the fats are cholesterol, triglyceride. Okay, and the cholesterol is divided into HDL, LDL, and the VLDL, in which HDL is the good cholesterol, and that improve our health. Okay, that needs for HDL is need for our body for our good health. Okay, but the VLDL, LDL, and triglyceride, these three fat or lipid are many dangerous to our body. So we have to reduce these type of cholesterol. For reducing these type of cholesterol, we need to take the proper medicine with proper diet. So the medicine that we use to reduce these LDL, VLDL, and the triglyceride, that are known as anti-hyperlipidemic agents. Okay, so the hyperlipidemia is the condition when the blood has too many lipid or fat, such as cholesterol and the triglyceride. And one type of the hyperlipidemia is known as hypercholesterolemia. Okay, hypercholesterolemia means in which our total cholesterol is increased. Okay, in which the total cholesterol is increased, their LDL is increased, triglyceride is also increased in that condition, but the HDL, okay, HDL will be reduced in that condition, because HDL is a good cholesterol. Okay, so hyperlipidemia means the blood has too many lipid or the fats, such as cholesterol and the triglyceride. And one type of the hyperlipidemia is known as hypercholesterolemia. Okay, hypercholesterolemia is the one type of hyperlipidemia in which in hypercholesterolemia, in which the total cholesterol is increased. Okay, total cholesterol is increased, LDL is increased, and triglyceride will be increased, but the HDL level will be reduced. So that is very bad for our health. Okay, so total cholesterol, that is very bad for our health, and that condition is known as hypercholesterolemia. And there is a chances of buildup of plaque inside our artery, and that blocks the blood flow, and that causes the risky blockage. Okay, and that causes the cardiovascular diseases also. So this hypercholesterolemia is a dangerous condition. So for treating this hypercholesterolemia disease, okay, we have to take the medicine with proper diet. Okay, when we eat fatty foods, so in that condition, without any exercise and all, okay, so in that condition, there are chances to increase the total cholesterol inside our body. So we need to take the medicine with proper diet. So hyperlipidemia means the blood has too many lipid or fats. Okay, the blood contain too many lipid or the fat, and that blood thickens. Okay, when the blood thickens, okay, there are chances to make the or build up a plaque. Okay, this cholesterol and the triglyceride, all the fats get deposited inside or on the wall of the arteries. Okay, so that buildup is known as plaques. Okay, I will show the one picture, so it will clear for you. So that plaque is also dangerous, and that plaque make our artery very narrow, and that blocks the blood flow. Okay, so the that cholesterol is divided into HDL, LDL, VLDL. Okay, so this HDL is good for our health, and we need to increase the HDL level if we want to increase our health. Okay, improve our health. And this LDL and the VLDL, LDL means uh, low density lipoprotein. Okay, low density lipoprotein is stands for this LDL. Okay, and VLDL means very low density lipoprotein. These two cholesterols are very bad for our health, and we need to decrease the level of these two cholesterol. And this condition increases the fatty deposits in the arteries and the risk of the blockage. So when the LDL and the VLDL or the triglyceride increases inside the blood, that this condition, okay, that condition that increases the fatty deposits in the arteries. Okay, and that fatty deposit is known as plaques. And when the fatty deposit increases inside or on the wall of the artery, what happens? There are risk to blockage. There are risk of blockage. So this is the hyperlipidemia condition. I will show one picture so that will clear for you. So this is the normal artery. Okay, inside the artery, the blood flows smoothly without any blockage. When the cholesterol, the lipid forms or build up some plaques. Okay, so these are the plaques. So these are the deposit of the cholesterol, fat, and all the things. Okay, so this is known as plaques. So look at this. When this plaque form inside inside the artery, what happens? The blood doesn't flow smoothly. Okay, there are chances to blockage. So when this plaque fully form here, so that blocks the blood flow. Okay, and that condition is known as atherosclerotic. Okay, atherosclerosis, and this plaque is known as atherosclerotic plaque. Okay, so this is the difference between the normal artery and the artery narrowed by the plaque. Okay, this is the normal artery in which the blood flows smoothly here, but when the plaque forms inside the artery, what happens? That blocks. Okay, this fat and cholesterol deposited inside the wall of the artery, and that may create the blockage of the blood. And when the blockage when the artery gets blocked, what happens? There are chances to there are generation of the there are chances to generate the cardiac vascular disease. Obviously, that generate the cardiovascular disease because the artery blocks here. Okay, by this plaque. So this is the normal difference between the normal artery and the artery narrowed by the plaque. Okay. So we have seen what is atherosclerosis. Okay, we have seen what is hyperlipidemic condition. Okay, and we have seen how many types of the cholesterols are there. Now this is the time to learn what is anti-hyperlipidemic agents. Okay, so anti-hyperlipidemic agents promote the reduction of the lipid level in the blood. Okay, so anti-hyperlipidemic agents are those drugs that reduce the lipid level in the blood. Okay, anti-hyperlipidemia. Hyperlipidemia condition means there means in our blood lots of fats and the cholesterols are present. Okay, so the anti-hyperlipidemic agents, what they do? They reduce the lipid level in the blood. Okay, anti-hyperlipidemic agents reduce the anti-hyperlipidemic agents reduce the lipid level or fat. Okay, reduce the lipid level or the fat level in the blood. Okay, and some anti-hyperlipidemic agents aim to lower the level of low density lipoprotein. Okay, some anti-hyperlipidemic agents, what is their aim? To lower the level of low density lipoprotein. Okay, some anti-hyperlipidemic agents are meant for lowering the low density lipoprotein, that is LDL. Some are meant for reducing the triglyceride level, and some are meant for raise the high density lipoprotein, that is HDL, increase. Okay, some drugs are meant for increase the HDL cholesterol level inside the blood in our body, because this HDL is very good for our health. For maintaining good health, we need high level of HDL. Okay, so these cholesterols are classified into LDL, VLDL, and the HDL. Okay, among these three, HDL is the good cholesterol, LDL and the VLDL are the bad cholesterol. Okay, so we have to reduce this LDL and the VLDL, but we have to increase the HDL. Some anti-hyperlipidemic agents are meant for lowering the or decreasing the LDL level. Some are meant for reducing the triglyceride level, and some are meant for increasing the HDL level. Okay, so this is all about the anti-hyperlipidemic agents. So there are lots of anti-hyperlipidemic agents available in the market. Okay, so in the medicinal chemistry, you have to learn the classification of the anti-hyperlipidemic agent. Okay, classification and each and every drug's structure, mechanism of action, and the uses. So once again, what is anti-hyperlipidemic agent? Anti-hyperlipidemic agents are those drugs that reduce the lipid level in the blood. Okay, anti-hyperlipidemic agents are those drugs that reduce the lipid level in the blood. Okay, and some anti-hyperlipidemic agents are meant for reducing the LDL level, some are meant for reducing the triglyceride level, and some are meant for increasing the HDL level. Okay, and what is atherosclerosis? Atherosclerosis is the condition in which lipid and the fats are deposited in or on the artery walls, and that deposit known as plaque. Okay, and that plaque is capable of narrowing the artery, and that blocks. When the artery gets narrowed, what happens then? The blood flow gets blocked. Okay, So we have seen one diagram also, what is atherosclerosis plaque. Okay, so that is the thing. When, and there are chances to burst that plaque also. Okay, when the plaque burst, so what happens, that blood get clot, okay, clotted inside the artery, and that blocks the blood flow, and that create lots of cardiovascular diseases. Okay, so, and this is, then what is hyperlipidemic condition? Hyperlipidemic condition is the condition where the lipid level or the fat level in our blood is increased. Okay, increased amount of the lipid or the fat level in the blood is known as hyperlipidemic condition. Okay, and one of the hyperlipidemic condition is hypercholesterolemia. In hypercholesterolemia condition, what is the total cholesterol of the blood will be increased. Okay, the level of the total cholesterol will be increased. In that, triglyceride also increased, LDL also increased, but the HDL amount will reduced. Okay, but we want high level of the HDL. So for increasing the HDL level, for decreasing the total cholesterol, LDL and the VLDL and the triglyceride, we are taking, or the patients are, or the doctors are prescribing this anti-hyperlipidemic agents. Okay, and these anti-hyperlipidemic agents are very useful in the cardiovascular diseases for thinning the blood. Okay, when the lipid level is high inside the blood, what happens, the blood gets thickens. Okay, to reducing that thickness, we can take this anti-hyperlipidemic condition, or to reducing the LDL and the VLDL and the triglyceride level inside the blood, the patient have to take the anti-hyperlipidemic agents. Or for treating the cardiovascular diseases, the patient have to take the anti-hyperlipidemic agent. All the doctors, they are prescribed to the patient, those are suffering from the cardiovascular diseases, these anti-hyperlipidemic agents. So let's see the classification of this anti-hyperlipidemic agent. This is anti-hyperlipidemic agents are classified into 4 types. HMG-CoA reductase inhibitors. HMG-CoA reductase inhibitors, that is known as statins. Okay, HMG-CoA reductase inhibitor is also known as statins. That examples are lovastatin, simvastatin, pravastatin, and the atorvastatin. Okay, so we have seen this lovastatin in the previous class. So HMG-CoA reductase. Okay, HMG-CoA reductase is the main enzyme that is necessary for the synthesis of the cholesterol. Okay, when the cholesterol level is high, we have to reduce the cholesterol in the blood. So we have to take HMG-CoA reductase inhibitors, means the drug that reduce the HMG-CoA reductase enzyme. Okay, that drug is known as statins. Okay, so the example is lovastatin. We have seen the structure, mechanism of action, uses of the lovastatin in the previous class. Then next is bile acid sequestrants, that is known as resins. Today we are going to see this bile acid sequestrants. The examples are cholestyramine, cholestyramine. Okay, cholestyramine and the cholestyramine is the are the example of the bile acid sequestrants, or we can say resins example. Okay, third classification is fibric acid derivatives. Fibric acid derivative is also known as fibrates. Okay, fibric acid derivatives is also known as fibrates, and the examples are clofibrate, benzafibrate, fenofibrate, gemfibrozil. Okay, clofibrate we have seen in the previous class. Okay, so we have done the HMG-CoA reductase inhibitors and the fibric acid derivative, that fibrates. Okay, next fourth classification is triglyceride synthesis and the lipolysis inhibitors. Triglyceride synthesis and the lipolysis inhibitor, the example is niconic acid. So niconic acid is not there in your syllabus, so you don't have to learn this niconic acid. Only the lovastatin is there. Okay, cholestyramine and the cholestyramine and the clofibrate, only 4 drugs are there in the anti-hyperlipidemic drug. Okay, so we have seen this lovastatin and the clofibrate from the category of the classification of HMG-CoA reductase and the fibric acid derivatives. Okay, so in today's class we will see the bile acid sequestrant. That is also known as resins, and the examples are cholestyramine and the cholestypol. Okay, cholestyramine and the cholestypols are the example of the bile acid sequence, or we can say examples of the resins. So let's see the bile acid sequestrant. So the example of the bile acid sequestrants or the resins example is cholestyramine resin. Okay, cholestyramine resin, and this is the structure of the cholestyramine resin. Okay, benzene ring. Okay, CH2, CH2, and third carbon atom is again connected with one benzene ring, and CH2, N CH3, CH3 3 bracket N number, means this is the linked moiety. Okay, so this is the structure of the cholestyramine benzene ring. Okay, benzene ring, CH2 and CH2, third carbon atom again connected with one benzene ring, CH2 and CH3 3. Okay, so NCH3 and CH3 CH3, 3 molecule of the CH3 is connected with the nitrogen atom. Okay, and this is the N number of the linked moiety. So this is the cholestyramine resin, and this is the bile acid sequestrants. Okay, we can say bile acid sequestrants. Okay, so the bile acid sequestrants. Okay, the bile acid sequestrants are a group of resins. Okay, so I have already told that this is the linked moiety. Okay, lots of this benzene ring and this CH2, CH3 and nitrogen atoms are connected. Okay, that may be 2 moiety, that may be 3 moiety. Okay, so these are the group of the resins used to bind certain component of bile in the gastrointestinal tract. Okay, so the bile acid sequestrants, what they are? They are a group of the resins. Okay, the bile acid sequestrants are group of resins that used to bind certain component of the bile in the gastrointestinal tract. Okay, so the bile acid sequestrants are the group of the resins, and they are used to bind certain component of the bile in the gastrointestinal tract, and they are highly positive charged molecule. Okay, so these cholestyramine resins, okay, or the bile acid sequestrants are highly positive charged moieties. Okay, so the bile acid sequestrants are the group of the resins that are bind with the certain component of the bile in the gastrointestinal tract, and they are highly positively charged molecule that bind with negatively charged bile acid in the intestine. Okay, so these molecules are highly positive charged molecules, and they are tend to bind with negatively charged molecule in the means some component of the bile in the intestine. Okay, so positive attracted towards the negative charged moiety. Okay, and that inhibit the lipid solubilizing activity. Okay, that inhibit when this highly positively charged molecule that bind with the negatively charged molecule in the bile, in the component of the bile in the intestine, that inhibit the lipid solubilizing. Okay, that inhibit the lipid solubilizing activity and block the cholesterol absorption. Okay, so what they are, these bile acid sequestrants are the group of the resins. Okay, and they bind with the some component of the bile. Okay, they bind with some component of the bile inside the gastrointestinal tract. Okay, and these bile acid sequestrants are highly positively charged molecule, and they attract towards the highly negative charged component of the bile in the intestine. Okay, and they bind with negatively charged molecules. Okay, because these resins are highly positive charged molecules, they obviously attract towards the negatively charged molecules. Okay, and bind with that negatively charged molecules and inhibit the solubilization of the lipid. Okay, inhibit the lipid solubilizing activity, and when the lipid solubilizing activity is inhibited, what happens? That block the cholesterol absorption. Okay, when this bile acid molecule, or they are highly positively charged molecule, and these are attracted towards the highly negatively charged component in the bile. Okay, component of the bile in the intestine. Okay, and they tend to bind with that negatively charged molecule, and that inhibit the lipid solubilizing activity. Okay, when these components bind together, that decrease the lipid solubilizing activity, and that block the cholesterol absorption. Okay, when the lipid solubilizing activity inhibited, that blocks the cholesterol absorption, and they also inhibit the reabsorption of the bile acid, and thus cause a contraction of the bile acid pool. Okay, so this bile acid sequestrants also inhibit the reabsorption of the bile acid. Okay, reabsorption of the bile acid is also inhibited by this bile acid sequestrants. Okay, and when the bile absorption or the reabsorption, bile acid reabsorption is inhibited, and that cause the contraction of the bile acid pool. Okay, that cause the contraction of the bile acid pool, and that leads to increased bile acid synthesis. Okay, that increases the bile acid synthesis. So this bile acid sequestrants are the group of the resins. Okay, they are highly positively charged. They are highly positively charged molecules, and these are used when these are highly positively charged molecules, and they are tend to bind with the highly negatively charged molecules. So what the bile acid sequestrant do? They are the bile acid sequestrant. This is the mechanism of action. Okay, so bile acid sequestrants are the group of the resins. Okay, and they bind with some component of the bile inside in the gastrointestinal tract. And these bile acid sequestrants are highly positively charged molecules, and they are attracted towards the negatively charged some components of the bile in the intestine. Okay, when they attracted towards the negatively or opposite charged, okay, in the some component to the some component, so what happens, they bind together, and that inhibit the lipid solubilizing activity. Okay, when the highly positively charged molecule of this bile acid sequestrants, okay, when they bind with negatively charged molecule of the bile, so what happens, that inhibit the lipid solubilizing activity. Okay, that inhibit the lipid solubilizing activity, and when the lipid solubilizing activity inhibited, what happens, the absorption of the cholesterol will be blocked. Okay, absorption of the cholesterol will be blocked, and they also inhibit the reabsorption of the bile acids. Okay, so these bile acid sequesters, they also they inhibit the reabsorption of the bile acids, and thus cause a contraction of the bile acid pool, and that lead increased bile acid synthesis. Okay, bile acid synthesis will be increased, and that compete with cholesterol synthesis in the liver. When the bile acid synthesis of the bile acid increases, what happens there, that bile acid is competes with the cholesterol synthesis in the liver. The body needs cholesterol to make bile. Okay, the body needs cholesterol to make bile, and the liver uses up the cholesterol in the blood, which reduce the amount of the LDL cholesterol circulating in the blood. So what happens here, these bile acid sequestrants inhibit the reabsorption of the bile acid, and that cause the contraction of the bile acid pool, that leads to increased bile acid synthesis. When the bile acid synthesis increases, that competes with the cholesterol synthesis, okay, in the liver. So normal inside our body, okay, body needs cholesterol to make bile. Okay, cholesterol is converted into the bile. So when the bile acid synthesis increases, the cholesterol synthesis or the amount of the cholesterol in the blood reduces. Okay, when the body needs cholesterol to make bile, and the liver uses up the cholesterol to make bile acid in the blood. And when the liver uses that cholesterol, that reduces the amount of the LDL cholesterol circulating in the blood. Okay, so this is the mechanism of action of this bile acid sequestrants. And the cholestyramine, Okay, here we are talking about the cholestyramine drug. Okay, cholestyramine binds to and prevent the reabsorption of the bile in the GIT. Okay, the cholestyramine bind to and prevent the reabsorption of the bile in the GIT. Since the cholestyramine resin is a strong anion exchange resin, it can exchange its chloride anion with anionic bile acid in the GIT, and this form of insoluble complex result in increased loss of fecal bile acid and the prevent its reabsorption into the liver, and decreases the body content or the blood content of the body content of the bile acid is compensated by an increase in the conversion of the cholesterol to the bile acid. So this cholestyramine resins, what they do, they bind and prevent the reabsorption of the bile in the GIT. Okay, they prevent bind with the bile and prevent the reabsorption of the bile in the GIT. And this cholestyramine resins is a strong anion exchange, means highly positively charged resin. It can exchange the chloride anion with anionic bile acid. Okay, chloride anion in the GIT, and this form, okay, when this exchange and this form a complex, okay, this form a complex insoluble complex, results in loss of the fecal bile acid and prevent its reabsorption into the liver. Okay, it prevent the reabsorption of the bile into the liver, and when the reabsorption of the bile is decreased in the liver, what happens, that decreases the body content of the bile acid. Okay, so this decreases the body content of the bile acid, and that decrease or that increase the conversion of the bile into the that increase the conversion of the cholesterol into the bile acid. Okay, that increases when the cholesterol, so normal is cholesterol is converted into the bile acid. Okay, so here this cholestyramine, what they do, they bind with the bile and they prevent the reabsorption in the liver. Okay, so what happens then, the synthesis of the bile is increased. Okay, how the bile acid synthesis increased, that cholesterol is converted into the bile acid. Okay, when this conversion increases, what happens, the blood level of the cholesterol will be reduced. Okay, so this is the mechanism of action of this cholestyramine. So the cholestyramine is an oral medication that reduces the level of the cholesterol in the blood by increasing the conversion of the cholesterol into the bile acid and improve the itching associated with liver disease. Okay, if there is any itching associated with the liver disease, that is also improved with this cholestyramine medicine. The cholesterol that is ingested or manufactured in the body is eliminated primarily by conversion into the bile acid in the liver and excretion into the intestine with bile. Okay, so the cholesterol is converted into the bile acid. Okay, by increasing this conversion, the cholesterol level of the blood will be reduced. Okay, and this bile acid, primarily by the conversion to the bile acid in the liver and excretion into the intestine with bile. Okay, so let's see once again the mechanism of action. The cholestyramine resin absorb and combine with the bile acid in the intestine to form an insoluble complex. Okay, cholestyramine absorb and combined with bile acid. Okay, combined with bile acid in the intestine, and that forms an insoluble complex which is excreted in the feces, and this result in a partial removal of bile acid from the enterohepatic circulation by preventing their absorption. Okay, when this excreted, so that results in that results in partial removal of the bile acid from the enterohepatic circulation by preventing their absorption. Cholestyramine is a large cationic exchange resin polymer. Okay, and it is also insoluble in water. Bile acid metabolites of the cholesterol are normally efficiently reabsorbed in jejunum and ileum. Okay, bile acid metabolites of the cholesterol that are normally reabsorbed in the jejunum and the ileum, and excretion is increased up to 10-fold with cholestyramine is given. When the cholestyramine medicine is given, the excretion is increased up to 10-fold, and that results in the enhanced conversion of the cholesterol to bile acid in the liver via 7A hydroxylation. Okay, so this increase the conversion of the cholesterol to the bile acid in the liver via 7A hydroxylation, which is normally controlled by a negative feedback by bile acid. Okay, so increased uptake of LDL cholesterol and LDL from plasma results from upregulation of the LDL receptors. Okay, increased uptake of LDL cholesterol and LDL from the plasma results upregulation of LDL receptors, particularly in the liver. Okay, therefore the bile acid resins, including cholestyramine, are not helpful in the patient with homogeneous familial hypercholesterolemia who have no functioning receptors. Okay, means genetic, the patient who are suffering from the genetic hypercholesterolemia, that patient is not treated with this cholestyramine. Okay, next, decreased activation of the farnesoid hex receptor by bile acid may result in the modest increase in the plasma triglyceride, but also improve the glucose metabolism in the patient with the diabetes. And the later effect is due to increased secretion of the incretin glucagon like peptide 1, that is GLP-1, from the intestine, that increasing the insulin secretion. Cholestyramine also interferes with the metabolism of the thyroid hormone. Thyroid hormone is metabolized mainly in the liver, where it is conjugated to glucuronides and the sulfates. And these conjugation products then enter into the enterohepatic circulation by excretion into the bile. Okay. Fraction of conjugated products are deconjugated in the intestine and free hormones are reabsorbed. In state of thyrotoxicosis, there is increased enterohepatic circulation of the thyroid hormone, and this cholestyramine decreases the reabsorption of the thyroid hormone from the enterohepatic circulation. Okay, so in the mechanism of action, you have to remember this only. The bile acid sequestrants are large group of the resins, and they are highly positively charged molecule, and they attract towards the negatively charged molecule that is present inside the bile. Okay, and they bind with that, the component, negatively charged component, bind with that and inhibit the lipid solubilizing activity. Okay, inhibit the lipid solubilizing activity. When the lipid solubilizing activity is inhibited, that blocks the cholesterol absorption. Okay, that blocks the cholesterol absorption, and they also inhibit this bile acid sequestrants are also able to inhibit the reabsorption of the bile acid and causes the contraction of the bile acid pool that leads to increased bile acid synthesis. When bile acid synthesis increased, that bile acid synthesis competes with the cholesterol synthesis also, because normally the cholesterol is converted into the bile acid. Okay, and when the bile acid synthesis, what happens, the body uses more cholesterol from the blood to convert into the bile acid. Okay, so when body uses the cholesterol from the plasma, what happened, the LDL level will be reduced. So this is the mechanism of action. Okay, and they form a insoluble complex. Okay, insoluble complex, and that decreases the body content of the bile acid, is compensated by the increased conversion of the cholesterol into the bile acid. Okay, so this is the only thing you have to learn, or you have to write in the exams if the questions will become. Okay, so let's see the uses of this cholestyramine. Cholestyramine is used to lower high cholesterol level in the blood. Okay, the cholestyramine is used to lower high cholesterol level in the, or to reduce the high cholesterol level in the blood, and this may help prevent medical problem caused by the cholesterol clogging the blood vessels. Okay, the cholesterol clogging by the blood vessels also treated by this cholestyramine. The cholestyramine is also used to remove substances called bile acid from body. Okay, so the cholestyramine is also used to remove the bile acid from the body. So this is all about the cholestyramine. Okay, next drug is cholestyramine. Cholestyramine is again bile acid sequestrants. Okay, so look at the structure. In the cholestyramine there are benzene ring, but in this cholestyramine there is no benzene ring, only the chain. Okay, so we can learn from here nitrogen atom, CH2, CH, CH3. Okay, three carbon atom with OH. Okay, 2 propanol. Okay, N is connected with 2 propanol. Then N is connected with ethyl. Here again 2 propanol. Again CH2, and this is the N moiety. N number of the moieties are okay, linked moiety. So this is the structure of the cholesterol. Okay, and the mechanism of action of this cholesterol is same like this cholestyramine. Okay, so this cholesterol, what they do, they are large moiety. Okay, they are large, they are group of the resins. Okay, look at this, N number of the resins are present in the cholesterol. So they are large number of the resins, and they are capable of binding with bile, some component of the bile acid, and they are highly charged or highly positively charged molecules, and they are attract towards the negatively charged molecule in the bile, and when these bind together, that inhibit the lipid solubilizing activity. Okay, inhibit the lipid solubilizing activity, and that blocks the cholesterol absorption. When the lipid solubilizing activity sorry, inhibits, what happens, that blocks the cholesterol level, and they also inhibit the reabsorption of the bile acid, and the cause the contraction of the bile acid pool, and that leads to the increased bile acid synthesis. When the bile acid synthesis is increased, that competes with the cholesterol synthesis, because this cholesterol is converted into the bile acid. So for increased formation or increased synthesis of the bile acid, what the body do, body uses the cholesterol present in our plasma, okay, to convert into the bile acid. When the body uses this cholesterol level from the plasma, what happens, our blood plasma cholesterol level will be reduced. So this is the mechanism of action of this cholestyramine. Okay, and the uses, this is used in the condition of hypercholesterolemia, okay, and hyperlipoproteinemia, and it reduces the cholesterol level. Okay, so look at this. Look at the uses of this cholesterol. Cholesterol is used along with diet changes to decrease the amount of the fatty substance, such as low density lipoprotein, that is LDL, cholesterol in the certain people with high cholesterol. And the cholesterol is in the class of the medication called as bile acid sequestrants. Okay, so the cholesterol is used to lower the amount of the level of the low LDL cholesterol from the plasma, and this is also, this is coming in the this is the example of the classification of bile acid sequestrants. Okay, so this is all about anti-hyperlipidemic agents. Okay, so look at the MCQs regarding this subject. Example of the bile acid sequestrants: cholestyramine. Okay, cholestyramine is the bile acid sequestrants example. Fibric acid derivative is also known as fibrates. So correct answer is fibrate. Cholestyramine is mainly binds with histamine receptor, binds with bile, binds with alpha receptor, binds with beta receptor. So binds with some component of the bile. Cholestyramine is used to reduce pressure, reduce cholesterol, reduce allergic condition, increase urination. So the cholestyramine is used to reduce the cholesterol. Which drugs are used to treat high cholesterol? Lovastatin, cholestyramine, cholesterol, all the above. So these three drugs are anti-hyperlipidemic agents. So these three drugs we will use to reduce the or to treat the high cholesterol level. Okay, so the correct answer is all the above. So we have done with our anti-hyperlipidemic agents here. Okay, so we have seen introduction part, we had seen the classification, and we had seen all the structure, mechanism of action, and the uses of the drug that is given in the syllabus. Okay, so this is all about anti-hyperlipidemic agents. Okay, I hope everybody understood it very well. So thank you.